Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response, and true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome back to the Vital Spirit podcast. I'm Dr. Kelly Livingston. Today's episode is a little bit different. I've done this once before where I called it a true crime episode because I'm a true crime junkie. I love investigating both health and true crime in my free time. So this is not a surface level overview. It's not a top 5 gut health tips episode. It's not a simplified version of what I actually do in clinical practice. What it is a true case walkthrough episode where I'm really going to walk you through how I think as a clinician, when someone comes in to see me and they have gut symptoms and we're wondering, is it IBS? Is it IBD? Is it something else? I'm calling it that very intentionally because for many patients, their gut story feels like a mystery. It feels confusing, it feels misinterpreted, and it often feels like no one's ever really taken time to look at the full picture. I hear this every day from patients. So today, I want to take you inside my clinical reasoning as a naturopathic physician who spent the last 13 years working with IBS, IBD, chronic GI inflammation, perimenopausal gut shifts, autoimmune disease, and mental health. And as a clinician who starts every single case with the gut-brain axis. Now, before we begin, I want to make sure that you have listened to the gut-brain axis series, especially part 2. And if you have not, also listen to the IBS episode. I strongly recommend that you pause and go back to those. You certainly can continue, but I feel like things will be a lot more clear for you if you have that background under your belt for this true crime episode. There are so many pearls in those episodes about what IBS actually is, what IBD actually is, how nervous system regulation fits in, and why we treat the terrain before we chase microbes. That will make today's episode land just much more deeply for you, and that level of understanding, I think, will be helpful. So today, we're going to walk through IBS versus IBD, so irritable bowel syndrome versus inflammatory bowel disease, when food is the main driver for each, and when it is not, how labs are helpful and when they're not helpful, and how I decide what layer is dominant in each patient, and certainly how the mind, body, and spirit are woven into every plan. This episode is for patients and for practitioners, and as always, we're going pretty deep. Okay, so let's start here. IBS and IBD are not the same condition, but they often live on the same spectrum of gut-brain immune dysregulation. So irritable bowel syndrome is a functional bowel disorder, like we talked about in those previous episodes, and IBD, or inflammatory bowel disease, is an inflammatory immune-mediated disease. This distinction really matters. IBS, you'll see normal structure on imaging and on colonoscopy, but you'll have altered function. You'll have altered motility, so frequency of bowels either slowed down or sped up. You'll have altered visceral sensitivity, so your personal experience of pain or discomfort. And you'll have altered autonomic tone, so the state of your nervous system. With IBD, we see objective inflammation. We see inflammation on labs. We're going to get into that in just a minute. We see immune activation. Very often, I'm seeing antibodies in those patients. We see gut barrier disruption or intestinal permeability, high levels of leaky gut. We see elevated inflammatory markers. Again, we can see this on labs. And there is risk of tissue damage if untreated. But here's where things get clinically interesting and where you need to be a really good detective. Both IBS and IBD are modulated by the nervous system, by the immune system, and by the gut brain axis. And both can be made dramatically worse or dramatically better, depending on whether the body feels safe enough to heal. So, first things first is which one do you have? And then the next step is what direction does our nervous system need to go to get our body into a healing state? The biggest question I have to answer as a health detective is, what is actually driving the inflammation? And this is the question that most patients don't get answered until they walk through my door. Is the inflammation driven primarily by food? Unfortunately, if you've seen a gastroenterologist, many times you've been told that what you eat does not matter. I don't know how this is still happening in 2026, but it is. Is inflammation being driven by immune dysregulation? Is there something in your immune system that is turning on the autoimmune bonfire that I always talk about? Is inflammation driven by microbiome imbalance? So dysbiosis, an imbalance of the good and bad bacteria or of amounts of bacteria or where that bacteria is? Is inflammation driven by nervous system threat signaling? We've gone really deep into this in previous episodes. Is it driven by trauma and chronic stress? Or is it a combination of all of these? And here's the really key clinical truth that I want to highlight, both for practitioners and for patients. For some patients, inflammation truly is driven primarily by food. And when that is the case, it can be one of the more straightforward fixes. And I love a good, simple, true crime case. This really, really matters because you, as the patient, deserve to know when something can be simpler. Not every gut case is complex trauma. Not every gut case is autoimmune. Not every gut case requires years of deep nervous system work. Some do, but some are really simple. And some patients can remove a clear inflammatory trigger, whether that's gluten, dairy, certain emulsifiers, alcohol, their individual food allergies or sensitivities, which I have an episode on, and their calprotectin drops. Now, calprotectin, we're going to get into, it's one of the main objective labs that we're tracking in IBD. You can also sometimes see it high in IBS, and then upon further investigation, that patient actually does not have IBD, but essentially it's a reflection of inflammation in the gut. And as it drops, when you remove the food triggers, their symptoms resolve, energy returns, your system is more calm, and your terrain is healing. When that happens, I celebrate. It's not too simple, it's good medicine. The key is not assuming which layer is dominant, but assessing it carefully with a thorough intake and lab workup. I don't skip steps because otherwise I'm sitting there wondering, have I looked into everything? Is there something else that can be rolled out? Is there something more simple for this patient to remove as an obstacle to cure? Okay, so now I'm going to take you inside the process of how I actually assess IBS versus IBD in real life. So when a patient comes to me with a diagnosis of IBS or suspected IBD or just unresolved gut symptoms and they have no idea what these I's are, I do three things simultaneously. Number one is a time-heavy intake where I can get to know them and establish a trusting therapeutic relationship, especially if you have never heard that food matters or that there's something to do about your IBS or IBD and you've been told there's nothing to do. In the case of IBS, often you're told there's nothing even found on labs. And in the case of IBD, patients are often told they'll need to go on a medication for the rest of their life. So they need to trust me essentially, and hopefully you're getting to know and trust me as well through the process of listening to the Vital Spirit podcast. But essentially, I need patients to trust me and I need to know them really well. Second is a nervous system and life context assessment where I'm scanning for stress patterns in your story. And third is targeted labs, not to label, but to orient. And again, to look for patterns in your terrain. Pattern recognition is everything in systems medicine and holistic healing. A stool test without a story is meaningless. And as I said in the previous episodes on IBS and the gut brain axis, I'm sure at this point in my career that I could look at labs and a stool test and design a protocol that would work well to alleviate symptoms. But I still believe that this is superficial treatment of a whole human. And this is why women end up in my office saying, I saw a functional provider and I didn't get any better, because we're missing the story. So I'm also always asking, when did this start? What else was happening in life at that time? What was happening hormonally? What was happening emotionally? What was happening neurologically? What was happening with food and diet? What other patterns in your mind, body, and spirit point us in the direction of real root causes, not just plug and play medicine treating a lab result only? There have been so many times throughout my career where a question just pops into my head. I certainly have my routine. I have the questions I always ask, but often as I'm hearing a patient's story, or I'm seeing how when they mention a period of time in their life, their body even contracts or tenses up. And I will get an intuitive hit sometimes to dig a little bit deeper or ask more questions. And often a patient will say, oh, I never really thought about that. Or, yeah, everything did really start around the time that X, Y, and Z was happening, or I had that gastroenteritis. So, again, having a trusting relationship so that you as the patient feel comfortable to share everything, knowing what questions to ask, and then also having the clinical expertise and background to have some bells go off or have some intuitive hits, I think is really important in the therapeutic relationship. So let's talk labs now. After I've gotten to know a patient and their history and context, some of the labs that I might be looking at, and again, I have previous episodes all about labs, but I might be looking at a CBC and a CMP, so a complete blood count and a metabolic profile, and I'm ruling out anemia, infection, liver or kidney dysfunction. These being normal does not rule out IBS or IBD, but I do want to make sure that some basic labs have been run. Of course, I'm going to go a little bit further and look at iron and ferritin. Now, low normal ferritin is incredibly common in gut inflammation. When we have dysbiosis, especially in our small intestine, it's going to impact how well we're absorbing our iron, and then that's going to impact our ferritin, our storage form of iron. And this is going to play a role in energy. So you might also feel really tired when ferritin is low. Thyroid conversion, which then further impacts gut motility. So it might lead to constipation if your thyroid's under functioning as a result of the low ferritin. It's going to impact your mood and hair. So if you have bowel issues and symptoms and your hair is falling out, please check your ferritin. Ferritin in the 20s might even be flagged as normal, but it is not optimal for midlife women. I like it around 75. And then before I even get into distinguishing labs between IBS and IBD, I'm always looking at a full thyroid panel. We've talked about that in our thyroid episode. So that's going to, yes, include TSH, your thyroid stimulating hormone, but also free T3, free T4, reverse T3, and your thyroid antibodies, because essentially I'm asking, is the motility of your bowels impacted by your thyroid in either direction? Is inflammation blocking thyroid conversion? And is this autoimmune? Sometimes I'll see autoimmune markers that are relevant to thyroid disease before they show up in the bowel, and vice versa. And so many gut cases improve when thyroid is supported. So if you have bowel issues, we absolutely need to do a thorough thyroid workup. Of course, I'm also going to look at inflammatory markers, right? You know about HSCRP, high sensitivity C reactive protein, which is an inflammatory marker that I run in almost every patient. Sometimes I'm also looking at interleukin 6 or tumor necrosis factor alpha. Maybe I'm looking at ESR, homocysteine, and I'm looking for inflammation patterns. But here's a key pearl. IBD, inflammatory bowel disease, can exist with normal CRP. So just because you don't have inflammation showing up systemically in your blood work doesn't mean that you don't have IBD. And that's why stool markers matter. That's why calprotectin matters. because stool is where the terrain really shows itself. So when I'm looking at the stool, the number one distinguishing marker between IBS and IBD is that calprotectin marker. Now, I will get calprotectin in my comprehensive digestive stool analysis that I run, and then I might send that person to Quest, for example, and we'll track calprotectin over time and we'll watch it come down as we work on our interventions. I'm also going to get a marker called fecal secretory IgA. Now, this is another inflammation marker, and it's also a sign that the immune system is locally upregulated in the gut. The stool test is also going to tell me about dysbiosis patterns. So, again, are there overgrowth of pathogenic bacteria? Are there yeasts that we don't want to see there? Are there parasites? Are there not enough of the good bacteria? So, maybe beneficial species are lacking, maybe keystone species such as Akkermansia are low. All of this information is in the stool test that I run. We're also going to get information about the microbiome metabolites and short chain fatty acids. I talk all about short chain fatty acids in our depression and SSRI and gut brain axis series, especially butyrate. Butyrate is one of the short chain fatty acids that we're using to heal and reduce inflammation in the gut. It comes from fiber. Butyrate comes from psyllium. It's why I start a lot of new patients on psyllium. So there is a ton of information in that stool test that helps me know, are we dealing with IBS or IBD, and what is the best next step for this patient? And an elevated calprotectin tells me that the gut immune system is on guard, it is inflamed. It does not automatically mean IBD, but it absolutely means that we're going to take it seriously and we're going to further investigate. If they haven't had any imaging done, I might be recommending that. I'm definitely going to run further antibody studies and make sure that I absolutely have already looked at food triggers for that patient. I just recently had a new patient where she was not coming in for gut symptoms at all, but on her stool test, her calprotectin was through the roof, as was her fecal secretory IgA. So that to me sounded alarm bells, and I knew immediately, put on my health detective cap and get to work, because there's something going on here that she did not realize. So let's give a couple case examples, and I'll start with an IBS case. So this patient came to see me. She was a 43-year-old woman. She was highly stress reactive. So she knew from her experience that her symptoms would flare when stress was high. When she was getting ready for a work presentation is when her symptoms were the worst, and they would fluctuate. She did have some food sensitivities that she knew about, but they were kind of inconsistent. She couldn't really pinpoint what to eat, what not to eat. And her labs were essentially showing nothing. So she was definitely told that her colonoscopy was normal. She was told that her labs were normal, and there was really nothing else to be done. Her patterns were certainly nervous system dominant. She had some visceral hypersensitivity, and her symptoms improved with regulation before eradication. So really just prioritizing calming her system down was the biggest clue to me, because she responded so well to that so quickly. So her treatment protocol really emphasized vagal tone, rhythm to her meals, breathing before food. We used bitter herbs as well during that breathwork practice. Some gentle massage, and not that we were looking for more motility, but we were looking for regularity and just providing safety and comfort essentially to her bowels. She used castor oil packs with meditation at night, and really, really minimal force was effective for her. Now, this is different than another patient who was more constipation dominant and had a lot of pelvic floor tension holding patterns. She expressed a lot of emotional suppression. She wasn't even comfortable in her first visit really telling me all of her history, which is absolutely fine and okay. And I wait for patients to, again, have that trusting relationship with me. And also, her labs were not really very dramatic. But this was more a pattern of dorsal vagal shutdown and her nervous system really restricting and slowing bowels. She also had what I would call sphincter discoordination. So I think her lower esophageal sphincter was actually playing a role based on her history. So she did also have some SIBO, bacterial overgrowth, in her small intestine. So initially we focused more on visceral manipulation. We focused a lot on pelvic floor health and awareness, gentle fibers that her body did well with, and of course, nervous system safety. In particular, she responded really well to homeopathy. We had used lycopodium, if I'm remembering correctly, and that was awesome. And chemotherapy. We did some drainage, energetic drainage work with her initially. Now, this is different than an IBD patient. So, in an IBD patient example, they're going to have objective inflammation. So, I'll give you an example of a patient who had really high elevated calprotectin historically and autoimmune patterns. So they had other antibodies showing up on their blood work. Now, their flares were linked to stress and to food. We did determine which foods were triggers, but they had a lot of inflammation on their labs. So initially, our treatment was really focused on immune regulation and downregulating the immune system and mucosal repair. So, of course, I was talking about the nervous system and mind body work, but I was much more focused on inflammation reduction from a physical point of view in the beginning. So, that mucosal repair did involve things like glutamine and mucilaginous and demulcent herbs and turmeric and curcumin extracts. So I was using things like turmeric root powder in their meals and drinks. And I was really trying to calm inflammation down as the first step. And this particular patient I'm thinking of, it was a teenager. And unfortunately, again, I had been told that what she ate didn't matter. So some of the battle in her repair and recovery was acknowledging that food was really inflammatory for her and that she had food allergies and sensitivities. And as she started to learn what her food triggers were, we weren't able to be as maybe strict about removing some of those inflammatory foods because there was some resistance there, but we were able to start to chip away at that inflammation, which then reduced symptoms. And she had started on some pharmaceutical interventions and she was able to pull back on those as inflammation calmed. So it was really, truly integrative care where I was meeting her where she was at and really doing my best to make it clear what her labs showed, what the best next steps were kind of in my world, but also that I acknowledged she couldn't necessarily make all of those changes at the moment and meeting her where she was at and going really slowly with those. And let's give another example where I think is a good example of where medicine is a little bit more an art form. So this patient had elevated calprotectin, but other markers were really non-existent and mild. So I paused and slowed down. I tried to assess, okay, how medically serious is this? What other labs do I need to run to rule out, scary, dangerous medical things, which of course I always do. So I retested and I watched for patterns. And I didn't want to panic the patient, but I obviously had to be medically safe and sound. So we had a lot of discussions around precision medicine essentially and what labs were best to run next, and not to instill fear in her, but to educate her on the best next steps to rule the scary things out, as well as the things that I really wanted her to focus on changing immediately so that we could see some changes in labs. And sure enough, that calprotectin did come down. And this is another good example of if you go to a conventional doctor, in my experience from what patients are reporting to me, sometimes there is a fear instilled in you around some of these issues, especially the autoimmune issues. And I'll have a whole other episode on other autoimmune diseases, but there's a fine line between being medically safe and taking the right next steps and instilling what I think is unnecessary fear. And I really try to give practitioners the benefit of the doubt because they're doing the best they can with the tools that they have and the education that they received and the paradigm that they work in. However, there is a whole other paradigm, and that's where we live here at the Vital Spirit podcast and Roots Deep Medicine, my clinic, where there are root causes, there are many tools, there are things to do, and we're not ignoring labs. We're running extremely thorough labs, but I am reminding patients every single day that the fear and being in a stressed fight or flight state is not allowing their body to get into a healing state. So I'm not saying don't do anything about it, but I am saying to tone the fear down a little bit. And when we're caring for our guts, whether IBS or IBD holistically, we have to remember top-down approaches, so assessing history of trauma, looking at stress, looking at that HPA axis and cortisol. Cortisol is going to create leaky gut and intestinal permeability. We've talked about this before. Looking at your ACEs score, looking at emotional suppression, and looking at nervous system tone, and also bottom up. So body up, looking at inflammation, looking at dysbiosis, looking at motility, assessing gut barrier integrity, and looking at immune signaling. If you only treat in one direction, you miss the whole picture. And I don't think you're a great detective if you're missing a whole half of the potential suspects in a case, right? So, this is why I start with the gut brain axis. The gut brain axis encompasses all of this in both directions. So, what is the healing order that actually works for both IBS and IBD and really any gut brain axis protocol? I mentioned this in our previous episode. Step one is regulation. The body has to be in a healing state to heal. We are going to move in and out of dysregulation throughout the day, throughout our lives. The point is not to be calm all the time. The point is to be able to move in and out of dysregulation and regulation in a healthy way, to come back to homeostasis, and to achieve parasympathetic rest, digest, and heal more than sympathetic, or at least have a balance of it. And I think most patients, when they initially come to see me, have about 80% of their time in sympathetic fight or flight. And we want that to flip flop a little bit. And the best time that you're getting into parasympathetic is, yes, when you're sleeping, when you're resting and digesting, but also take those pauses, take those parasympathetic snack breaks throughout the day. Do a 5-minute breath work practice, do a 1-minute breath work, sit on the floor, sit in the sun, go outside. All of these little parasympathetic snacks add up to regulation. Next is rhythm and sleep, which kind of feeds off of being in a regulated state and having healthy rhythms to our day. Our body thrives on regular rhythms, not rigidity, but sending, again, a signal of safety, a signal of predictability. And this also helps with our HPA axis and our sleep patterns. 3 is lowering inflammatory load. That's why we recognize and remove sources of inflammation. As you know, if you've been listening along, that's going to include foods, that's going to include microbes, that's going to potentially include chronic viral load, unhealthy emotional processes. All of that is included in that step. Next, we're supporting digestion and absorption. If you're not making enough bile or pancreatic enzymes or hydrochloric acid in your stomach to break down food and absorb it, then we've got to work on that, right? That's a high priority. Then we rebuild the microbiome. So sure, we might be focusing on RID protocols in the next step, but we have to make sure that we have some healthy microbiome there to work with. That's how we balance out that dysbiosis seesaw. So then the next step would be targeted RID protocols when appropriate. There is a time and a place to get rid of things from the body, but it is not without everything else that I just mentioned. And then I would wrap this all up with meaning, knowing your why and your purpose. If you don't know why you're doing something, chances are you're not going to do it. That's why I've joked in a couple episodes that going really in depth over labs is how I can positively manipulate patients to make changes, some of which seem really drastic in the beginning. So you have to know why you're doing this, right? And you have to know your purpose. Why do you want to feel healthy? Why don't you just want to take a pill or eat the standard American diet and be inflamed and sick? What's the reason behind this? Again, I would pull back to that kind of safety umbrella of you have to be in a healing state to heal, and connecting to something bigger than yourself, and knowing that the goal in a lot of the work that I do and this path to individuation and self-actualization with women through midlife is so that we can trust our gut instincts again. And if you have an inflamed gut and all of this going on in your gut, it makes that really hard. And most patients start at step 6, at trying to get rid of something that they found in a lab. And I think that's the real reason why a lot of women stay stuck on that healing hamster wheel. And this matters so much to me because IBS and IBD affect our freedom, our ability to move through the world, our trust in our body, our identity, our sense of safety, and our relationship with others. And especially because there's this gut brain nervous system piece. When your nervous system is dysregulated, it is going to dysregulate and impact the other nervous systems around you. And that's why I always say that we can heal the world one regulated nervous system at a time. So when you have gut symptoms or when you have things on your labs that point in the directions of a lot of inflammation in the gut, that is also going to dysregulate your nervous system and have a ripple effect out into the world. So, true IBS or IBD healing is not just symptom reduction. It is definitely not just turning off your immune system with a drug for the rest of your life. It's re inhabiting the body, it's listening to what the body is telling you. The body has something to communicate to you, and that has been through gut symptoms. And this is why mind, body, and spirit are never optional in my work. They're all one thing, they're all connected, they're all communicating. Some gut inflammation is complex, some is immune driven, some is trauma mediated, and some is really simply food driven. And that's okay. As always, the message here is that your body is not broken and it doesn't need to be silenced with strong immune suppressant drugs. It is communicating. And when you understand the language, healing becomes coherent. And sometimes healing is as simple as figuring out what foods you're allergic to. And I love when it's that simple. So definitely check out those previous episodes. And if this episode resonated, make sure you go back to the gut brain axis, re listen to the IBS episode, download your free vagal tone guide if you have not already, and you can get started on regulation today. And I highly recommend, if you're a new listener and you're curious about working with me, that you explore the Calm Gut, Clear Mind 21-day gut reset program. I've even had patients who have been patients for a long time who consistently revisit that because it's a wonderful reset. And of course, it's the new year. So a lot of people find that's a great time to focus on their health awakening journey. So you can go to my website, drkellylivingston.com, to check that out. And we'll put a link in the show notes as well. Thank you for joining us today. I'll see you next time as we move into the IBD deep dive, because I haven't gotten as deep as I'd like into inflammatory bowel disease and all of the causes and all of the treatments that naturopathic medicine can offer. And this IBD episode has been a request multiple times because patients of mine who have worked on colitis or Crohn's with me are some of my biggest healing warriors. And I even have one who's offered to be a guest, and she's going to tell her unique healing story, which is really cool. So remember, the body heals. You just have to figure out the obstacles to cure or the suspects in your true crime case. So please share this with someone who needs to hear this today. And be sure to download and subscribe so you don't miss any episodes and we can reach more healing warriors. Have a great day, and I'll see you next week.